Welcome to this episode of Loving Yourself. My name is Serena C. Welcome to the show. And today I have someone very dear to me because he went through, a very difficult part of my life with me. He's my doctor. My endocrinologist and also endocrinologist to a lot of people from Gleneagles, Dr. Saiful Kassim. Welcome.
Thank you, Serena. Thank
Actually,
you for having me.
Dr. Saiful actually went through one of the most difficult phases with me because during my thyroid period, I went through multiple doctors actually because a lot of people don't realize that thyroid has many, many aspects. My journey was I had multiple forms of thyroid issues, which we are going to dive into today, so that if you have similar issues, that hopefully, this speaks to you and you can contact the right people. For example, Dr. Saiful Kassim, which has such a long bio that I need to read through here. But in essence, Dr. Saiful came from the background of graduating in Ireland, many years in the UK with so many awards I cannot even start to read. He's also lectured in UK and Malaysia, and now is a mainstay and a big name in the endocrine and diabetes department of Gleneagles Kuala Lumpur. Does that kind of cover it?
You're too kind about that, Serena.
But well, that's what's written, and that is over 20 years of experience in the UK, by the way. And I do believe you contributed to a lot of studies as well, development in this, disease, right?
Yes.
Yes. So he is more than credible to talk about this. I picked Dr. Saiful because also I've seen many thyroid doctors. Not a lot are able to explain the disease in simple terms. It is not an easy disease to explain to laymen, isn't it?
Absolutely.
Most of the time when I step into the clinic, I feel like I'm talking to my shrink. Because is that what thyroid is? Let's start with, what is thyroid disease and why does it, affect your entire body, your hormones, your feelings, your highs and lows?
Yeah, I mean, it's such a difficult condition to describe in layman terms, to be honest. The thyroid gland is something that sits in your neck.
Right.
So you can imagine it's like a butterfly-shaped gland above your clavicle, just this bone that sticks out, and below your hyoid bone. And you can actually feel it, and it makes two hormones. And these hormones control every part of your body. And so your metabolism of how your brain functions, your heart functions, your lungs, your bowels, even your skin. But a lot of people come to me when they feel tired, palpitations, so the heart racing. Sometimes they describe it like a bullet train in the heart.
That's what I went through. We're going to explain later.
Yeah, and then they get the shakes, and then they get the weight loss and the sweating. But I notice a lot of people describe this feeling that even when their boss speaks to them, they start crying. For no reason, spontaneously, they just feel sad as well as anxious. There's a split of emotions.
It's harder to control.
Yeah.
Is that thyroid related? Would that be your area?
That is thyroid related. That's when the thyroid is overactive. Is when you have too much of T4 and T3. Yeah.
Because there are so many symptoms that can be confused with a lot of things, like, for example, premenstrual or perimenopause, So how do you distinguish that? Is it peri or is it thyroid?
So all hormones are interrelated.
Right.
That's one thing. And it all comes from the master gland, the pituitary gland, that sits in between your eyes.
Pituitary is here.
Yeah.
I know because I went for the MRI.
So if you drill about that much in between your eyes, you'll reach that. And I call that as the master controller. And that master controller controls other hormones. So there is a triumvirate of hormones that are interrelated with thyroid. So you got thyroid, you got another hormone called cortisol, the third one called cholecalciferol, vitamin D, and a lot of these.
The third one is?
Vitamin D, actually. Vitamin D is misnamed as vitamin. It's actually a hormone.
Oh.
Cholecalciferol, yeah.
Okay, so we got thyroid, we got cortisol, and we got vitamin D, which is actually a hormone.
Yeah. Not a lot of people are aware of that.
Now we know. How does that work?
Yeah. So hormones are something that the body produces. So the body does produce cholecalciferol. And again, all these three hormones interact with each other and access the same organs as well. So a lot of the time you feel tired, it's an interplay between these three.
Wow. Okay, there's actually a lot of things that we need to talk about when it comes to cortisol as well. No, but let's focus on thyroid.
But thyroid in itself, I mean, you're asking, what is thyroid disease? I mean, thyroid disease is when you have abnormalities and these two hormones, the active hormone, T4, which is converted to T3. If it's too high, it's overactive. If it's too low,
Yeah.
it's underactive.
What causes it to be too high or too low? Is it genetic, or is it stress, or is it lifestyle?
Okay, there's a lot of causes. The simplest one, commonest one that we all get is the autoimmune.
Right.
Which means that you have antibodies
Right.
that your body makes and attacks the thyroid. There are
What
two of them.
causes it to attack? Like, you know?
Why does it happen?
Yeah, why does it happen?
In some people, there's a genetic predisposition. So there are certain genetic, I'm going to get technical, like what called loci. There are a couple of them. I don't want to get into the details too detailed, but they get activated and it causes these antibodies to be formed and they start attacking the thyroid. For example, if you get COVID or if you get influenza, you make antibodies to fight that infection.
Right.
But unfortunately, in patients with autoimmune disease, about 10% of them turn on itself and attack the body's specific endocrine organs, whether it be the thyroid and elsewhere.
So instead of attacking what it's supposed to attack, it turns around and attacks your body.
Yeah.
How does someone get an autoimmune disease? Is it something you're born with, or?
Yeah. So there are, as I said, genetic predisposition.
So it's genetic.
Part of it is genetic. So like autoimmune Graves' disease, which is when you have increased amount of thyroid stimulating antibodies that attack the thyroid, or autoimmune Hashimoto's thyroiditis, which is increased amount of thyroid peroxidase antibody that attack the thyroid and make it underactive.
They're both considered autoimmune.
Autoimmune, yeah.
Okay.
But all these autoimmune diseases are related with other autoimmune diseases. So you've got...
you see why this is confusing.
Yeah, so you can get autoimmune diseases of the joints.
Okay.
So rheumatoid arthritis.
Okay.
Or SLE, so systemic lupus erythematosus. There's autoimmune bowel disease, colitis.
Oh my.
Oh yeah, ulcerative colitis and Crohn's. And it just expands, you know.
So these are, how is this connected to thyroid?
So because they're all autoimmune cluster, when you have an autoimmune thyroid disease, if it's not well controlled, then it can just have a domino effect and causing the other diseases. So it's really important to, once you diagnose a thyroid, control that as soon as possible.
Okay, so you stop all these other autoimmune diseases from rearing their heads, because right now, you know, especially after the pandemic and with social media, you see all these celebrities coming out, you know, confessing that they have this autoimmune disease, it's becoming a lot more prevalent. So what you're basically saying is, if thyroid is under control, all the rest will not come out. Hopefully not.
Hopefully not. But the idea is, you know, with any chronic disease, and this is what it is, if you don't treat it properly, and if you are exposed to certain things, it can actually cause relapse.
Relapse or flare up. You say flare up.
Indeed.
Okay, so let's, to make things easier, use me as an example. So I'm your best case study. If you don't know my story, I'll just link it somewhere, because I've actually interviewed you before during my course of treatment for thyroid. In 2019, I realized that I kept losing weight without any reason. I just thought I was very fit because I was a gym goer, and I wouldn't get tired. I would do cardio like crazy. I would eat like crazy, and I would keep losing weight until my friends told me, "Oh no, something's wrong. You know, you look different." And then the palpitations were the telltale. That's when I started to see Dr. Saiful, because my mother and my father's side both had thyroid history. So that's already like ding, you know. So if you don't know about this, thyroid is not something that you can check through your annual basic health blood check. It's something that you have to ask for a liver function test, you know, certain markers. So, you know, you cannot just go for a blood test and determine if you have thyroid issues or not. Although that was how my markers popped up. So they did a, what do you call it, full blood test, and the T3, T4 came out not the way it's supposed to be. That's how I started seeing a doctor, and eventually how did we figure it out? I don't know, you did your thing, that it was Graves' disease. Graves' disease, one of the more serious version of hyperthyroidism. Hyper is, you can see I lose weight and all that, so that's hyper. So on the other end, it's Hashimoto's. We can tackle that later, but this is my story, okay? So it's Graves' disease, and then on top of that, after seeing you for a few months, we realized that my eyes would not stop protruding. So right now you're looking, I already have very large eyes. If you saw me during COVID, you would have been scared.
Beautiful eyes.
Thank you. He's very kind. I didn't pay him. But imagine goldfish. I would liken them to goldfish eyes, you know. Mine actually protruded to the point of 4 millimeters, which is quite serious, yes? So what's the maximum that you can protrude before the whole eyeball? Does it fall out?
We use this machine called an exophthalmometer, which we measure how far it goes out. 4, 6, 8 millimeters.
8? 8 would be like pug.
Yeah.
Do they
But that's
actually
because the
fall
muscles
out?
behind your eyes push it forward, and then you lose the ability to actually have mobility of the eyes and really dry eyes and red
if you
eyes,
do if you do Google, you know, Graves' disease, by the way, is one. On top of that, I had thyroid eye disease. It's not actually the same thing, which eventually led to my operation because I was not just seeing Dr. Saiful, because Dr. Saiful is endocrine. Did you know you have to see an ophthalmologist as well, a specialist for the eye? So the conclusion was the ophthalmologist said, after a few months of seeing myself as well, that it was not coming back. And hence the decision to go for surgery. So if you're wondering where your thyroid gland is, somewhere here, if you can see it's out. So after that came out, my entire gland came out, everything stabilized, and then I had to cut my eye open as well to take out all the deposits that became fat. That's why I look like a goldfish and come back to sort of normal. The name is called decompression. My eye is still a bit bengkak. I don't think you can actually completely fix it, can you?
Not completely, no.
So it's still like a bit bengkak, but it's okay. I look a bit better than a goldfish. So that was my journey. So did I take the right course? I'm not sure, but okay, get out of your doctor hat for a minute and be a friend. Do you think this was half doctor, half friend? Because a lot of people are saying, oh, you didn't have to go for surgery. You know, there are a lot of hormone replacement therapies and things that could have helped you. But this decision to do the surgery was after consultation, second opinions from so many of you, doctors who said, no, you have to go for surgery because if not, this is going to eventually pop out. And then that was the decision that I made. So do you think that's a fair summary of what happened to me?
Yeah, it's an excellent summary.
Oh, thank you.
And I have to say, what you went through, out of, let's say, 100 patients that I see, you're probably in the 5 patients out of the 100. You had the whole plethora from the very beginning of the journey when you had a lot of antibodies attacking the thyroid, then it started attacking the muscles behind your eyes. And then because of the lack of response as well to the therapy, that's why you needed to undergo lots of treatment, steroids for the eyes, surgery for the eyes, and taking out the thyroid gland. If I go back historically, there's a guy called Sir Robert Graves.
Yes, hence the name Graves' disease.
Graves' disease. Yeah. He actually did say that the best treatment for this is surgery.
Oh, really?
Because you remove the thyroid gland. There's nothing for the antibodies to attack
anymore.
So therefore, you will not produce too much T4 and T3 to do the awkward business of turning everything on. So essentially, you did have the curative procedure. You did get the right thing. The only thing is that not a lot of people want to have surgery, and that's why we always offer that 3 options: medications, radioactive iodine, and surgery.
Right.
The thing about medications is that sometimes, even after you've completed it for about a year to 2 years, it may relapse.
So does that mean it would be a lifelong thing? If you had predisposition to thyroid, would it be a lifelong thing, the threat of relapse?
Yeah, so the longer that you have been relapse-free or in remission, the less likelihood of it coming back.
So autoimmunity basically just means we are weaker than everybody else. Sort of.
But
more susceptible to relapse.
But it doesn't stop you from living your life to the fullest.
Not at all. I'm right here, you see. Although during my fight of Graves' disease and all that, I mean, Graves' disease is the name of the man, but Graves' disease is also how you look. You have to look it up because one of the main symptoms of Graves' disease was insomnia. Remember, I did not sleep much, and I really did look like death. And coupled with this, the protruding eyes and all that, I'm a host. So that took my confidence from here to non-existent, right? So yes, you can live your life. after,
Yes.
or maybe some people during, if they don't have the thyroid eye disease and the extreme Graves' disease that I have. But would you agree that it's quite debilitating
Yeah.
to have a disease, a thyroid disease? It's not as bad as cancer, although the words you're using are very similar, relapse, remission, but it is debilitating, isn't it?
It is. I'm amazed at how you manage to continue your activities that you're doing, because a lot of patients tend to just regress and find
Even
it difficult.
after
Yeah,
the
so
surgery?
they find it difficult to face the world. They get these sort of I wouldn't call it bipolar, but they go from anxious to depressed, and because that's part and parcel of the thyroid disease, and they think these palpitations is abnormal, the tremors, the weight loss, how people comment on them, or you look very sick, have you got cancer or something, because they've lost a lot of weight. So it affects the self-esteem. So a lot of people tend to withdraw into a shell. So I'm amazed that you've done so well to emerge from that shell. You weren't affected by that. Some of them, they need to go and see psychiatrists because of the psychological issues with it.
Yes. So, in essence, you're saying that taking this out was the best that I could have
you
done.
You had the cure. You don't need to worry about the thyroid anymore.
He did say that after I take this out, that I could go under, I could put on weight, and I have not. What are the chances of? This is a success rate then?
Yeah. So you're 1 in a million, Serena. It's very rare for patients after thyroid surgery not to put on weight.
Vast amounts of weight.
90% would put on a lot of weight, like 5, 6, 7 kilos is quite normal. Post-thyroid surgery, even with thyroid hormone replacement.
But it is possible to reduce the weight with workout, with diet and workout.
Yeah.
So you see, everything is actually linked.
It is.
So let's say if I was not what I am now, and I came out of it gaining 7 to 9 kgs, I would imagine my depression would be worse. So it would lead to diet, lifestyle change, and again therapy. So thyroid is like full spectrum. You have to understand what you need to do, which is why it's very important to pinpoint how, you may or may not have thyroid issues. It can start as early as what? How old?
So thyroid disease, you can have congenital thyroid disease. You can be born with it.
Oh, God.
Yeah.
Okay.
So we have had patients where they've had thyroid issues from birth, and they're hypothyroid throughout. So they have what we call thyroid agenesis. The thyroid gland doesn't form.
And how do you know that if you're a kid, for example, that you may have thyroid issues?
The doctor must, or the pediatrician must be pretty clued in.
Oh.
And normally most hospitals do check the baby's
From
thyroid
birth.
function. Yeah.
Okay.
But that's one way. But most of patients with thyroid disease develop that, in their teenage years. I've seen a couple in their teens, mostly between 20 to 40, and mostly ladies. That's when the thyroid gland decides to become either overactive or underactive.
Why do you think it's only in women? I mean, mostly in women.
Predominantly, it's for thyroid disease is usually about 3.8 to 3.5 per thousand population. Men is like 0.8 per thousand population. It's something that we see.
Yeah.
Sex-wise, we don't know, but that's how it's.
I actually read an article lately that said, look, it's possibly predominantly women because men don't complain. I don't know how true that is, but it is true. I mean, to a certain extent, if you compare myself to my husband, sometimes he'll say, suck it up, it's just your mood, it's your hormone, when I'm in pain, I don't talk about it. There might be some truth in there that maybe the numbers in men don't show up because they don't report it.
Unless it's really severe. And the problem, if men get it, they have higher risk of relapse compared to women.
Oh, really?
Yeah.
Okay, that's something to think about.
And harder to treat as well.
So maybe men should talk more about their feelings, because this is very feeling related. Right. Every time I see you, I feel like I'm seeing a psychiatrist, psychologist, because he actually has the patience to listen to me. I remember each visit was about how do you feel, what kind of thoughts have been going through your mind. Like, I wasn't actually sure if I was talking to an actual endocrine or, my psychiatrist.
Because sometimes that's how people describe their symptoms. Sometimes they say, oh, when I send my daughter to school, I feel like crying more. You kind of go, okay, that's what's going on there. Because actually it's the patient's story that gives you clues.
So that's why a good doctor is important, because when I tell you my life story and you go like, oh, that's probably why this is this and that is that, that's important. So I wanted to say, okay, For someone who may not know, I mean, if you're a woman or a man, that they may have hyper or hypo issues, what are the things to look out for again?
Sudden outbursts, and then, or they're just sleeping in bed and they feel a bullet train going in the heart and wakes them up from bed.
Okay.
The bed is
we're talking about hyper
sweaty.
now.
Yeah.
Okay, hyper.
Yeah,
Okay.
that will be hyper kind of things. And that's when you start checking to see, well, let's see what your thyroid function test is like. So you do the free T4, free T3, and TSH. So that's the answer to the diagnosis. But at the same time, I always tell my patients, if your doctor checks that, make sure the doctor also checks your cortisol and your vitamin D, because sometimes the cortisol might be low, and that can also cause the lethargy. Or similarly, the vitamin D. Because if your vitamin D is low, it will increase your antibodies that attack the thyroid.
Okay.
Because vitamin D is very important in the immune system,
Right.
milieu. So if you got low vitamin D or vitamin D deficiency,
Right.
which most of us, 4 out of 5 Malaysians are vitamin D deficient.
Yes.
Because we all stay indoors. Huh?
Yes, we don't go out
like
into the
going
sun.
out.
Vitamin D, yes.
Yeah.
Yes.
So there's a higher likelihood in our population that autoimmunity also goes up. And when the TSI goes up, the thyroid stimulating antibodies go up, the thyroid goes up.
Right. So the thyroid attacks more when your antibodies go up. And if you have low vitamin D in your body, that triggers it. How about cortisol? How does it affect the thyroid?
So there are 2 hormones in the body that are like twins, as I call them, cortisol and thyroid.
Right.
Okay? And they're usually part of this autoimmune milieu as well. So one is the Graves and Hashimoto's. Cortisol is either low cortisol, called Addison's disease, which is an autoimmune disease.
Right.
So usually when I see patients who have tiredness,
Right.
right, and you think, oh, it's thyroid, you check the cortisol, and usually it's low at the same time.
Okay.
Yeah, and that's when you have to treat both.
Oh my. Okay, so it's both of them.
People say cortisol is like a stress hormone.
Yes, it
I
is.
don't call it a stress hormone. It's actually I call it your fight or flight hormone. It's a hormone that you need to run if a tiger's running at you. Yeah, That
It's a
gives you
survival hormone.
Exactly.
Right.
Yeah, but if it's too high, it's a syndrome called Cushing syndrome, which is not autoimmune. So it's different. But what I always tell my patients, if you feel tired, make sure the doctor checks your cortisol as well, not just your thyroid. Because there's a rule in endocrinology.
Okay.
You cannot just treat the thyroid.
Right.
You must make sure that the cortisol axis is okay.
Okay.
Because the two of them go hand in hand.
So basically, just check the cortisol
Yeah,
as well.
yeah.
Okay. Yeah. Speaking of, that's one thing we didn't tackle. Brain fog
Yeah.
is predominant in both hyper and hypo.
Yes. It's actually worse in hypo.
Okay.
I've had patients who've forgotten names of their husband. It just...
It's not dementia.
No, it's not dementia.
That's extreme.
And we call that mixed edema coma. Sometimes they go into a coma.
What?
The patients who have severe hypothyroidism,
As in, they just collapse and go into a coma.
they go into coma, they go into ICU, they have fluid around the heart,
Oh, wow.
pericardial effusion, fluid in the lungs.
Right.
They're swollen, the heart function drops, and it takes a while to stabilize them, put them on IV thyroxine. So it can get really serious.
So these are the extreme cases.
There's a
but-
spectrum of thyroid disease.
I know. That's
like
why
your
it's
good
so
self,
confusing.
you went through that spectrum.
Yes, I went through the entire spectrum.
Yeah. 'Cause most people who go through thyroid disease, as I said earlier, they only start tablets,
Right.
and after a year, they're stable,
Yeah.
and they don't come back because the thyroid hasn't relapsed.
But there is still a chance of relapse, like
There
you
is
said.
still a chance later on, yeah.
Because when I went to Dr. Saiful, I remember you were not encouraging surgery to begin with because you didn't know the severity of my case. So I was actually on all types of tablets to try to combat. And I remember every month when I saw you?
That's right.
The tablets would be adjusted.
Yes.
It got to a point where it was so confusing. I just listened to you and wrote down what I needed to
Yeah.
take on a daily basis. But I mean, that kind of makes it difficult for people to live a daily life to try to remember all this. So there are 2 types of people. The people who go the tablet way and hope to recover, and there are those who go the surgery way. Whichever way you think you might want to choose is obviously up to you, right? But which one do you think you encourage more?
We follow guidelines.
Okay.
So the guidelines always state to us, you always try the non-invasive pathway first, which is medications.
Yes.
There's a myth that they say, once you're on thyroid medications, you're on it for life. Absolutely not true.
Yes.
Normally for overactive thyroid, you try to limit it about 12 months. If the antibody is still high, you'll extend it to about 18 to 24 months.
Okay, so it's case by case and you follow guidelines.
Yeah.
And in terms of me,
Yeah.
I could not because this was getting more severe.
Because your
correct?
antibody levels were high. So
It kept staying high.
Exactly.
Okay,
So
that's
the
right.
thyroid stimulating immunoglobulins or antibodies did not come down. We always say that if it's high, if we stop treatment, it's like flipping a coin. You have
Right.
a 50% chance of it coming back.
I had to either stay with medication for another 6 months to see what would happen, or but I had no choice because this was getting very
Exactly.
serious. That's me. But if your medication works, then by all means stay with it. And doctor would talk to you every week like a best friend to fix your moods and all, because it is all mood, isn't it?
It is.
Sometimes I come in very high, and sometimes I come in I really don't feel like talking to you, isn't it?
Yeah.
So yeah, that is one thing. But also, no, before I forget, and I will forget. Birth control. How does birth control pills
Yeah.
affect the thyroid the whole thyroid thing?
Yeah.
Because I was told not to take any more birth control
Oh, yeah.
pills, and then I got pregnant.